In Facebook land, we are so excited to come to you today. We have a very exciting topic. We're going to talk about something that's very interesting, and of course, it's heart attacks. And so we have Dr. Ferrara with us, and he's going to tell us a little bit about his things that we're doing today. Dr. Ferrara, you want to say hi to everybody?
Hello, everyone. This is Dr. Ferrara. I'm just trying to put this in my share in my book, trying to figure out how to do it.
And that's it. That's the other one there. So
Just hit right post.
yeah, actually, that's the old one.
Oh,
Yeah, so we are here live with you guys. So if you're watching this, you're probably laughing at us.
no. I'm just trying to figure technology here.
So we want you guys to give us your opinions and let us know what your thoughts are. You know, give us some symptoms of what you think a heart attack is, and we'll go ahead and go from there and let us know. Thank you guys so much
Yeah, I
for
just
tuning
shared
in.
it. I hope I did.
And we'll go ahead and go from there. So, Dr. Farrar, before we begin, because a lot of times when it comes to like symptoms of a heart attack, let's first of all talk about how can we avoid a heart attack?
Yeah. Well, that's the first question. The first thing is actually one of the things you have no control over is the choosing of your parents.
Okay.
The most research shows the most important risk factor is actually genetics. And it's based on if anybody in your family, usually the more direct it is, like your father, mother, grandfather, grandmother, uncle, who had a history of having a heart attack or heart symptoms, whether they needed a stent or a bypass or died of coronary artery disease before the age of 50. So those of you that had grandparents and then the father died, before, in the 40s, usually the younger it is, the worse it is. It's time to get checked out.
Wow.
So that's one thing, is the biggest risk factor. But the other things are, one is diabetes. And a lot of times, if you develop diabetes, you have control, how well you control the diabetes. That's one. High blood pressure is another risk factor. So, and again, it goes back to the topics, how to keep your blood pressure low by the things we talked about, exercise, weight control, and things like that. Then there's cholesterol, which you can control with meds these days. And then smoking, and that's probably the number two, smoke. To prevent all this.
What about like types of foods?
Obviously, the food with the diet, the increase. Fast foods all the time, the things that are greasy and fried. All the things that they tell you not to do.
Okay.
Things with a lot of butter.
But they taste so good, though.
They do taste good. And a lot of meat and things like that. So all the things they tell you about diet, and all the way to cholesterol. And then the smoking is the other one. And unfortunately, some strokes. I mean, it's kind of interesting. I've always seen a stroke in somebody under the age of 70 if they smoked. It's rare that you see it if they hadn't smoked.
Wow.
So it plays a big role. We know that.
Now, what about too, like exercise?
Exercise definitely.